Hi everybody, my name is Rhys Barber. I'm the audiologist here at Audiology Associates. We upload new earwax removal videos every Monday, Wednesday and Friday at 9 PM UK time, so please consider subscribing. Hi everybody, this is Rhys Barber from Audiology Associates. Thank you very much for watching our earwax removal compilation video today. So we've got 3 patients in our compilation. This first patient's come through with some reduced hearing, very blocked up ear. So you can see that we're just using the standard size Zollner tube here just to work some of this thicker, darker wax off the canal wall first of all. You can see how it's thickened up and become quite sticky around the edges. So just very slowly teasing this off the canal wall here, just guiding it towards the entrance of the canal. We've got a good firm suction grip on here, but what you can see is we're trying to wiggle this out of the canal, but it's quite firmly wedged in at this point. Just trying to work this one up off the base of the canal there. You can see it's just really struggling to budge it at the moment. Just getting the bottom section. You can see there's a piece of skin that this has actually been sitting on, so a piece of dry skin that's been kind of anchoring this in place. Now we've got rid of that, you can see there's a bit more movement to the wax now, so we're able to wiggle it a little bit more because that skin isn't holding it in. So as we take it away, there we are, you can see we just got a nice big chunk come away there. It's actually brought the next part of this wax from deeper in the canal to the outer section here. So back in with the standard size Zollner tube now. Just working this up and down, trying to wiggle it out. There we go. That's another big piece gone. And we'll just check behind that. You can see there's even more behind there again. So we're just going to pop back in now with the Zollner tube. You can see where it's quite firmly attached to the base of the canal. It's actually liquefied and stuck to the canal there. So we're going to lift that piece off first. There we are, just working it up off the base of the canal. You can see folding it up. It's quite thick though, this wax, so we're just trying to get as much of a grip as we can on it. Just working a piece off this right hand side wall now. That's the more prominent piece, you see, so we're working on that bit first. Just give the endoscope a bit of a wipe over because it's starting to mist up a little bit. Just trying to break this section off the bottom. Sometimes if you get a nice ledge that comes off the kind of base of the wax, you can work where that ledge joins the main bulk of the wax because it'll give you a nice grip from both sides then, you see. There we are, just coming to the outer part of the ear canal now. There we go, working it around that last bend. As you can see, there's one more piece further in, so quite a bit of wax in this canal. The wax itself had actually gone from the front to the back and worked its way all the way down to the eardrum itself. Here we are, just wiggling that last piece out now. Oop, just got stuck on the way out. Oop, hit the camera as well. There we go, you can see the eardrum there. So nice and clear now on that side. So this is what we removed. So you can see quite big chunks there. So that's what, just over 3 centimeters. About 1.25 inches thereabouts. So this is the second patient in the compilation. So this patient's come through a similar story to the last one, very blocked up ears. We can see we've got a little bit of a skin, underlying skin issue there that needs to be peeled away as well. So you can see we've got this little blob at the entrance here. This section we're working on now is actually a little piece of skin. You can see as we lift up, you can see those bits of skin there as it comes into the, it just gets sucked into the end of the suction tube. So loosening that off the base, just trying to get a little bit of a grip on the wax as well. You can see it's getting sucked into the machine there. There we go, got a good grip on this bottom section now. Now there's got to be another piece of skin in here, very similar to the last patient. There's got to be a piece of skin in here that's holding everything into place, because as we're getting a suction grip on that bottom section we were just working on, this section here, it's really not giving very well, and we're getting quite a good suction grip on there. So normally it would pop out of that gap quite easily, but we're having to really kind of wiggle it to work it out. There we go, just starting to get a grip on that, on the top section now, on that smoother bit, pulling. There, can you see that length of skin that's disappeared into the canal there? So that's what was anchoring everything in place. As we've taken out, it's pulled it from deeper in the canal. Not going to budge with the suction, so we're just going to use the forceps here just to get a grip on this section. There we go. You can see there's a section just at the bottom there. There you go, just gripping the edge of that skin, wiggling that up and down. And the last piece coming away of skin there. Oh, just almost lost a grip on it then, so just grabbing another stronger grip. There, like you see it pulling from deeper in the canal there. Look, so it's actually dragging the next section of skin forwards. There we go, so peeling all that away now. Now we've got rid of that, it should allow this last piece of wax now to come away a little bit more easily, because that skin is just not hanging around, not blocking everything in. There we go. So there's that piece of wax. You can see a little bit of skin to the right side. Eardrum looks nice and healthy though, so we just need to clip that last little bit of dry skin away. There it goes. And the eardrum looking really healthy, really shiny. Okay, so this is the same patient with the second ear, but very different wax in this ear. So you'll be able to see it's very wet, lovely and shiny, which means there's been a lot of kind of softening. So a lot of olive oil gone in here to soften this up. And what you'll see now is as we get a grip on this, very different, because as soon as we get a grip on it, the whole thing practically peels away in one piece. And we just take the top section away then, and just sort of bring this bottom section out here. There we go. And eardrum looking good on that side as well. So this is what we removed. So you can see how long some of these strips of skin were, and then we've got the kind of darker waxy parts there as well. Okay, third patient now in the compilation. So we've got quite a sort of long piece of wax really in this canal. Bit of a gap above the top there. Just going to use the standard size Honor tube to get a grip on this. Just getting a grip, just trying to work it off that left canal wall. While we're just working on this bit, we've I actually met some a YouTube subscriber earlier, came into clinic. So I just wanted to wish everyone who down at Southampton Uni who's doing the interactive theatre on Wednesday the best of luck. I hope it all goes really well for you guys, and thank you very much for watching. So we're just working this last piece. There you go, just off the canal wall there, so we can get a good grip on it, so we can start taking this out of the canal. You can see we've got a nice grip now with the suction tube. There we are, it's broken the end off there, so we're just going to work on this next section now. It's a little bit drier, you can see, as you go in. The first section looked really wet, but you can see the colour difference, so it's not as shiny. It doesn't look as kind of liquid around the outside, so this is a much kind of drier type of wax, so it's not really budging very well. So we're going to use the Jobson horn, just following it in when we first used it, just to get it into position. So we go above, tilt the Jobson horn up so that we get a grip behind, and then bring it forwards to bring it out to the canal. There you go, just start to see it coming away. It's broken a front section away there. You can see that softer kind of wax there. So we're just going to go back in now. Same procedure, just tilting the front end down so we can see the back end there. Just gently maneuvering this out. There you go. So now we're able to get behind it. So we'll go back behind again now. Just at the top, look, trying to disappear behind the wax, pull forwards. And there we are. So you can see we've got a nice chunky bit of wax there. This is the eardrum, a slight dullness to the eardrum there, usually an indication that there's either fluid present or the eardrum's not sitting in its normal position. This is the second ear of the same patient, so you can see that we've got a piece of wax stuck to the right canal wall. Using the standard size ulnar tube now just to pull this off the wall. There we go, taking the first chunk away. That was the softer piece. You can see a little bit of dry skin flicking up there on the right hand side. There we go, that's the offending piece of wax taken away. Eardrum looking good. So this is what we removed from the last patient. You can see the larger pieces there, larger chunks come away. And that's it there in inches. Thank you very much for watching our video today. If you did enjoy the video, then please like. If you're not subscribed already and you'd like to do so, you can click the subscribe button here. If you'd like to check out some more of our videos, they're also up there. Now, if you want to follow us, you can do on Facebook, Twitter, Instagram, and also check our website if you want to know a little bit more about us. As always, guys, until the next time, take care.